So the partnership came about really through collaboration between members of the executive teams in both organisations, ESNEFT and Colchester Institute, who had some shared goals, I guess. For ESNEFT it was around recruitment and expanding their workforce, and for Colchester Institute it was around finding appropriate roles for our college leavers, whether they're going on to university and then into work, or in many cases direct into the trust.
For ESNEFT, we need a workforce of the future, as I say, and we would be foolish to look beyond the fact that there's something in the region of 400 young people currently studying health and care in our two vocational colleges, plus an adult population out there in the community, all of whom are looking for rewarding jobs, and we have that at ESNEFT. So the key benefits for us as an employer locally was twofold really. Firstly, to develop that pipeline, so we've got an increasing number of local people coming into jobs at entry level, which hopefully we will then help to develop into higher banded jobs to become the radiographer of the future or the occupational therapist of the future. But secondly, getting local people into work is great for people's own health.
For us at Colchester Institute, we've definitely seen growth in student numbers. We've seen an increase in health and care applicants, as well as this year applicants to healthcare science, which was another initiative between ESNEFT and the college. I think having ESNEFT staff at our open events just brings to life the real opportunities that students joining the college to study health and social care or science have in terms of work placements and the Career Start programme and other things, and I think that's been really beneficial.
Okay, so the Career Start programme is a programme where we prepare learners for entry into the NHS. So it begins with an interview programme. So the interviews are done by both people from ESNEFT and Colchester Institute, so it's a dual selection process. The learners then progress on to a work placement, which they have input in choosing. They have a nominated mentor, they have masterclasses, training at the Iceni Centre, and they have a guaranteed job interview at the end of their programme. Throughout that time, Colchester Institute gets feedback on their progress. We have a nominated person who's got a role funded by ESNEFT, the ESNEFT Partnership Manager, which is a crucial link between the two organisations, and that gives a constant flow of information between the two organisations.
The key magic ingredient behind the relationship really is about developing that relationship between the two sets of staff involved. One of the first priorities was to try and formalise that in terms of a memorandum of understanding between both organisations, where we committed to a range of actions and outcomes, and that laid the groundwork for the things that we then went on to do.
So I think the most important ingredients of establishing the partnership were around those relationships, not only at senior level but all the way through the organisation, so that people in both organisations had a counterpart that they could work with, and they supported each other really to work towards our shared aims. I think one of the most important things was the establishment of the Memorandum of Understanding between the two organisations, which listed our objectives as a group, and gave us a bit of a framework, I guess, to work towards. We then established a board, a partnership board, which uses that Memorandum of Understanding to set kind of quarterly agendas for meetings, and we look at how we're working towards and achieving on those various objectives. And the objectives range from things around the curriculum that we deliver, through to recruitment of ESNEFT staff to deliver some of our curriculum, the use of resources. ESNEFT have been very generous in financially supporting purchasing of equipment, some of which is in the area that we're in now. There's been a whole range of different things which have really made that package very successful. So we've definitely seen growth in the number of students applying to health and social care programmes. We've seen around 50% increase in numbers joining those programmes. I think that's a lot of that has been to do with the fact that we are able to promote the Career Start programme and the placements within ESNEFT, and the presence of ESNEFT staff at our open events who talk to applicants, talk to parents about the range of opportunities that are provided by the close working relationship between the college and the trust. We've also seen a significant increase in the number of students progressing directly into roles within their local hospitals as well, which is of course great news.
So one of the huge benefits of our relationship with ESNEFT is using the expertise from ESNEFT to help us design our curriculum. So a good example of that is selection of units, modifying our selection of units from our level 3 programme. A really good example is the incorporation of infection control unit. So one of our tutors met with the infection control team from ESNEFT, designed the assessment with BTEC guidelines, and then they came in and delivered sessions to our learners, so co-design and co-delivery, which is great for our learners to see people from ESNEFT, the infection control team. They can ask them questions and they can get real life experiences, but also when Ofsted come visiting, then I can show just how real that experience is for our learners. We've got a significant amount of funding from ESNEFT, so we've got resources, both physical and staffing. We've got 2 roles funded by ESNEFT, the ESNEFT Partnership Manager and a professional trainer, and they allow us to access work placement and develop relationships between the organisations. I have staff here that are from ESNEFT, so the profile of Colchester Institute within ESNEFT is high. We're developing the relationship in terms of workforce needs, and so I can approach ESNEFT if I need any teaching filled.
What the Career Start programme allowed me to do was to get a guaranteed interview scheme, which is basically where when you apply for a job, you basically get an interview guaranteed. And then it's just all down to you basically. So my experience with the Career Start programme was that I basically acted as a HCA. So I did everything that they did. They showed me everything. The staff were really nice. So the role I've been offered is a elective orthopaedic in the elective orthopaedic centre, which is basically just for surgeries. They're opening 3 new wards and loads of surgeries, loads of theatres. Sorry, and yeah, I got given a healthcare assistant band 2, and I'm looking to do a apprenticeship level 3. My mentor did help me out a lot. She basically guided me, sent me loads of emails and links to different jobs so I could apply for them. She also helped me out with knowing where everything is around the hospital, as well as the ward sisters and all of the staff. Really just really helped me out.
Huge benefits for learners: exposure to practicing NHS professionals, a general increase in the awareness of the job roles within ESNEFT, a programme of visiting speakers so they know what roles there are, access to fantastic facilities, access to work placement, access to Career Start and guaranteed job interviews, and a general feeling that the Centre for Health and Social Care Professions has got a professional air about it. We call our learners professionals in training, so they're exposed to ESNEFT professionals on a regular basis.
I don't think there have been many challenges facing our organisation in this whole relationship. I think the work that we do with Colchester Institute is not difficult. The relationships that we've got in terms of personnel between us and Colchester Institute make it very easy. The fact that we are all very clear in terms of why we're doing this and what we hope to gain out of it just makes everything run smoothly. Probably the biggest challenge that we've got as an employer really is that we've got a huge demand on our services, and our recruiting managers tend to want ready cooked staff. So they want the finished article because they need them very quickly. So the challenges, if any, are managing to persuade recruiting managers and our departments to offer up things like work placement opportunities and or look to Colchester Institute and people coming out of the Institute for their recruits.
I think some of the challenges are just around different ways of working. So in further education we have a language and jargon. In the NHS there's a language and there's jargon, and sometimes that can create barriers. Just understanding each other's organisations. It took me a little while to work out where the trust fitted in with the integrated care system and so on. But just by talking regularly and establishing that strong relationship, we work through the differences and come out the other side. I think challenges can arise where staff members change, because, as we've said, the relationships are really, really important, and when people move on, they've got to be rebuilt. So having that framework was really important to ensure that when there is kind of turnover of staff, we can continue the initiatives and the work together.
Yeah, my top 3 recommendations for anybody else looking to work in partnership with their local vocational colleges would be, firstly, to put the time and effort into developing the relationships. So at a personal level, making sure that those relationships are strong just makes everything very, very much easier. When we pick up the phone to Colchester Institute, it kind of answers yes before we even ask the question. Secondly, be creative. So, what I found is that we're doing a huge amount of things now together as two organisations that, again, I don't think is rocket science, but we haven't been doing it in the past. So just being creative, because we're doing things now that the organisations would not have dreamed of 2 years ago. And thirdly, kind of leave no stone unturned. So there's huge amount of opportunities out there. We're looking at things like nursing associate roles now, and making sure that there's a real join up of the sort of stepping stones from leaving college interested in a career path to roles like healthcare support worker.
I think the advice that I would give to another college thinking of working in this way with their local trust would be to make sure that those relationships are well established and at as senior a level as possible to really drive the work and make sure it happens. Set up some form of framework, whether it's a partnership board or something different, that will enable you to monitor progress as you go along and measure whether you're achieving on the goals that you've set. I think that's really, really important. My hopes for the future with this partnership are that it will continue to go from strength to strength. We'd like to see even more young people taking up the Career Start programme opportunity, and more people progressing as a result of that into roles within the trust. We'd also like to continue to seek out, and we will continue to seek out, opportunities for work in the community, joint work in the community, in particular where there is grant funding available for specific projects in the way that we have worked together in the past and are doing so currently.